Good afternoon and welcome to our webinar. Thanks for your participation. This is the second of two webinars. The first was on RRI and the biosciences. Today is on the implementation of RRI in specific research organizations. We will have a first part with some presentation, and half of the time, more or less, will be for questions and discussion. The webinars is one of the products of our STARBIOS2 project. The second webinar has three themes: the steps of the self-interpretation for implementing RRI, the critical areas of implementation, and some example of the practice of RRI in biosciences organization. Example will be on the experience of FIOCRUZ in Brazil. They will present how they are promoting an action plan, and 5 action plans of STARBIOS2 in Europe, particularly in Italy, Bulgaria, UK, Slovenia, and Poland. As you remember, in the first webinar, we started from the definition of RRI provided by the European Commission. The European Commission defined RRI as an approach to research that anticipates and assesses potential implication and societal expectation, so that we foster inclusive and sustainable research and innovation. Biosciences, according to us, needs RRI to make sure that the research and innovation are aligned with the values and needs of the society that we live in. The practice of RRI and structural change of research organization in the biosciences is based on a self-reflection process that has 5 steps. First step, to practice RRI, it is important that the research group or organization formalizes its own position within the biosciences sector. In this process, you will need to map the actors with which your organization or your group maintains relationships, and possibly identify new actors with which a relationship needs to be established. The actors can be research actors. They are directly involved in research project implementation and financing, or stakeholder of research activities that will include the research users, CSOs, policymakers, etc. It's also important to define the position of each organization or actor concerning the main challenges that are prominent within the sector. There could be policy, scientific, innovation, and ethical challenges. This reflection will help each organization to define and develop a vision that includes the position toward the critical aspect of and other actors in its field. Second step, in order to implement an RRI plan, you need to have a team For this, you need to identify actors, people that can help to design and implement an RR&I plan. A good start is to involve actors that are already carrying out RR&I related activities. It's also important to know what RR&I activities are already ongoing in your organization. First step, to promote RR&I, it is vital to identify the problems that need to be addressed. This can be done by an analysis of the current state of these problems, by consulting internal actors, and by engaging people or groups within your organization that are already carrying out de facto RR&I initiatives. The 5 RR&I keys can be used as a guide for this consultation. The fourth step, after the identification of the problem to address, it's time to decide what needs to be changed. We proposed using the so-called principle of action that we discussed in the first webinar. Some domains of the organization life could be the object of the action for change, while other initiatives could be out of scope. Objects that are in scope are the organization's roles, routines, mission, group research vision, etc. Out of scope would be a legislation change. It's not up to organization. The changes have to consistently impact the organization sector, action, identity, culture, and agency. Negotiation is an essential part of the process because it helps to define how the changes should be introduced or to manage consensus and possible conflicts related to these changes. Step 5. After you have identified the challenges and problems that you want to address and what you would like to change, it's time to make an action plan. This action plan is essentially the how-to of RR&I. To activate an action plan is a complex and non-linear process. An action plan is a process that can be represented by this figure. The following moments are essential in this process: activating a current team and an extended team, that is, people that will help to promote and implement the action plan, carrying out a context analysis of the action plan setting, defining a detailed action plan, finding and mobilizing the actors that will play a role in the change towards RR&I, and negotiating the process of implementation of the action plan and address by negotiation the emerging problems, conflicts, and issues. The action plan should have lasting effect or produce structural impacts and reaction. A last moment, therefore, is a self-reflexive exercise on the results being obtained and on the possible changes in the initially foreseen actions. In the next session, we will discuss some of the critical aspects in implementing an action plan. The first area concerns the establishment of the core team and its maintenance. In implementing our action plans, we found that it is critical that the core team ensure its continuity and stability, acquire a wide set of knowledge and competencies, conciliate research activity and core team membership, including the possible time conflicts. The second area concerns the analysis of contextual factors. It should include external factors, for example, national policies and regulation, culture, etc. Internal factors such as organizational culture and values, leadership attitudes, previous experiences within an organization, and the entire set of relations with external stakeholders. This analysis helps to single out problems and opportunities for RR&I and structural change. The mobilization of the internal social actors beyond the core team is also crucial. The critical issues emerged were a possible diffidence toward RR&I among bioscientists, a low priority acknowledged to RR&I related institutional changes. The participation in the action plan in the RR&I activities deviates from the main objectives and daily needs of researchers. The third area concerns the negotiation of change during implementation. Negotiation is a type of interaction necessary for the realization of many activities foreseen by an action plan. It is a complex activity, since such interactions are of different types. They concern, for example, the operational implementation of the activities, the creation of consensus among the actors, the reduction or elimination of conflicts, and so on. Negotiation is often underestimated also because it often takes place in highly informal contexts. It is somehow invisible. The fifth area concerned the self-reflection over the activities carried out. Self-reflection cannot be taken for granted. In our experience, we noted that there is a need to understand the emerging factors that hinder and facilitated the practice of RRI, and this requires a learning process. The unexpected effects of an action plan must be brought under control through procedures that are not usual for researchers in the field of biosciences. The ability to interpret what happens with an action plan has to be developed. Now, I will leave the floor to our colleagues from Brazil, who will talk about the ways in which they understand the responsibility in their research organization. Then there will be some example of implementation of RRI within a research organization through action plans. So, Fernanda, I leave you the floor.
Okay, thank you, Andrea. Hello, good afternoon, everybody. My name is Fernanda Khouri. I work as a professor at the Federal University of Bahia in Brazil, and I am a postdoctoral research at FIOCRUZ. On behalf of FIOCRUZ team, I will talk a little bit about the process of implementing RRI here in FIOCRUZ based on the STARBIOS project. First, I want to say that FIOCRUZ is a research institute whose aim is promoting public health in Brazil, for example, developing vaccines and medicine. And at the same time, FIOCRUZ has 32 postgraduate programs with doctoral and academic or professional master degrees. So many research and students are involved in the actions of FIOCRUZ. The STARBIOS FIOCRUZ team consists of 3 members. I, who have a degree in biomedicine, and as I said, I am a postdoctoral research at FIOCRUZ. The Dr. Marta Giovanetti, who has degree in human biology and is also a postdoctoral research at FIOCRUZ too. And the Dr. Luiz Alcantara, who coordinates FIOCRUZ group and has degree in pharmacy. He is a researcher at FIOCRUZ and a professor at the Federal University of Minas Gerais. Together, we are trying to apply some concepts of RRI in our research here in Brazil, in addition to promoting these concepts within the institution. And I will report here how we are doing this and what are our action plans for the future. So the first activity that we could apply some RRI concepts was at the Zebra project. In fact, our country is currently facing an important arbovirus epidemic, and we work in this context in collaboration with the Ministry of Health through the Zebra project. So the Zebra aims to investigate the molecular epidemiology of Zika virus and other arbovirus in real time in a mobile laboratory in Brazil. And we do this through the generation of complete genomes from the positive case. In this project, we carry out entomology, sequencing, and bioinformatics analysis activities. And we performed all the steps while maintaining gender equality and, of course, following ethical principles. And it is important to say that all the data generated is made available in real time on the Zebra website to reinforce the importance of open access in science. The second activity was based on the need for technology transfer. We took the course entitled Nanopore, Based Gene Sequencing Technology for Temporal Investigation and Epidemiology of Dengue Outbreak, Training, Research, Surveillance, and Scientific Dissemination. So we carry out training on the techniques used during our activities related to the epidemiologic surveillance of arbovirus in Brazil. And the cool thing about this course is that at the end, all the students had the opportunity to produce a paper from the analysis that they learned during the training. The third activity was a workshop in Minas Gerais state. In this workshop, we discussed the importance of ethics in the context of bioscience. The fourth activity was a presentation on the responsible research and innovation for PhD students at the FIOCRUZ. Actually, this activity worked as a preview for the 50th activity. The 5th activity was a workshop on gender and public participation at FIOCRUZ. This workshop was attended by many people with experience in the field, and in this event were discussed projects involving the concepts of RRI, which are already carried out by FIOCRUZ, as well as new ideas, of course, for expanding these projects and disseminating the concepts in other institutions. The feedback from the students who participated was very good, and we believe that this meeting enhanced the discussion of the topic by postgraduate students. And now I will talk a little bit about our action plans for the future. The action plans are defined in order to make and adjust these already existing practice more systematic and relevant to our institution. So we intend to do the inclusion of training for technology transfer in research projects. Beyond that, we would like to run some open access seminars about the concepts of RRI with online transmission, and we think that this may work like that webinar, for example. In addition, we propose the implementation of a discipline focused on postgraduate courses to work on the principles and application of RRI here in Brazil. And at the same time, I need to say that FIOCRUZ has already taken other action plans, and you can see more about it on the FIOCRUZ website. It is possible to follow the progress of these other actions taken by the institution within the context of the RRI. So this is just a quick overview of what we are doing in our action plans for the future. And thank you very much for your attention, and I'm available for questions and suggestions. Thank you.
Thank you very much, Fernanda. And now I leave the floor to the other colleague of the University of Rome Tor Vergata that will provide example on the implementation of the action plans. Carla, please introduce briefly yourself and go ahead with your presentation.
Good afternoon to everybody. I am Carla Montesano, and I am immunologist in the University of Rome Tor Vergata, and I'm also coordinating the project. So our action plan covers all 5 RRI keys, and you can see here. And our focus today is on one activity in particular that is described in the context of societal engagement. In particular is the assessment and improvement of UNESCO Interdisciplinary Chair of Biotechnology. And this activity is also connected with biotechnology transfer in developing countries and regards also the education. The UNESCO Interdisciplinary Chain Biotechnology is the first UNESCO chair in Italy and has been founded in 1998. And it became Interdisciplinary Chain Biotechnology and Bioethics in 2016. And now is again changing thanks to the project. So the mission of UNESCO chair has been technology transfer and professional training in Africa. In practice, this meant that we conjugate education and social engagement keys of RRI through the involvement of several stakeholders with different expertise and role. During the last 4 years, the chair was under the lens of STARBIOS2 project, and thanks to the activity of Work Package 2, the chair has gained awareness on its activity and its role in the community. Thanks to STARBIOS2, the activity of the UNESCO chair have been also rationalized and are being developed. In bold, there are 2 paradigmatic examples of our activities that I will describe in a few minutes, and in red, 2 ongoing activities. Our activities has been developed during the years, approaching several emergencies such as epidemic, while at the same time dealing with the organization and logistic of our partners, mainly in African institutions, by transferring technology, by training and educating healthcare workers, and also helping them to continue the started assistance work autonomously, also beyond the emergency phase. Together with the implementation of health assistance, we have always promoted research. Why public engagement is so relevant for us? The ability of UNESCO Chair was to coagulate the efforts of many stakeholders in coping the emergency of Ebola outbreak in 2014-2015 in Sierra Leone has been a big effort that was fruitful. As you can see, a lot of partners participate to this big adventure to fight the Ebola. So the Molecular Biology and Immunology Lab, the MBL, that we build, is a high containment laboratory to fight against Ebola virus during the last Ebola outbreak. And the MBL was established in Sierra Leone to allow the reopening of the Holy Spirit Hospital that was closed because of the risk of high contagious of Ebola among the patients. Thanks to the STARBIOS2 and the connector organization of UNESCO Chair, a training course of Cameroonian pharmacists has been carried out in Rome in our laboratory for introducing the good laboratory and manufacturing practice in Cameroon. The next one, a meeting with African PhD students, with professors and also rectors, was organized in October 2018 for discussing, interpreting, and introducing RRI in Africa. Another experience of UNESCO Chair was the European program to support capacity building and the treatment of HIV infection in the Benghazi Center for Infectious Disease and Immunology in Libya. In fact, in 1998, at the pediatric hospital in Benghazi, over 400 children were accidentally infected with a single strain of HIV. And the work of UNESCO Chair was aimed at reinforcing the laboratory to improve the level of care of HIV-infected patients, mainly children, up to the international standard in synergy with other European partners. It was also scientifically demonstrated through the DNA sequencing of HIV that 6 Bulgarian nurses who stand accused and sentenced of death for infecting the children with HIV were innocent. Such results supported the existence of nosocomial transmission scenario, suggesting that pediatric hospitals had a long-standing infection control problem. So we have used, also in this case, the weapon of science to defend human rights. And so our motto could be fight human rights by the weapon of science. Thank you to everyone. So I am here for question and suggestion. Thank you.
Thank you very much for your presentation, Carla. And now I leave the floor to our Bulgarian colleagues, in particular to Dimitar Djilianov of the AgroBioInstitute of Sophia. Please, Dimitar, just a word for introduce yourself and for your presentation.
Hello, my name is Dimitar Djilianov, and together with my colleague Daniela Moyankova, I will make a very short presentation of our work inside the project STARBIOS. Both of us, we are coming from AgroBioInstitute, the leader of plant biotech in Bulgaria. Our institute is relatively young. We are 35 years old as an institute. And from the very beginning, we try to be updated in all the activities of plant biotech all over the world. So let me just focus on two of the topics that we work in our action plan, which is public engagement and ethics. the first thing that we did during the working on public engagement was to establish Plant Biotech Information Center as a focal point and engine of all RRI internal and outreach activities of the Institute. All the activities related to education, gender, open science, and ethics go through the PBIC. And in this respect, it became really a focal point of the public relations of the Institute. We established a plantbiotech.bg webpage that you can see here, and where we try to be very regular in uploading all the novelties in this fast changing area of plant science and science as a whole knowledge. In respect of continuation of the work of the Plant Biotech Information Center, we will do our best to maintain all the activities related to contacts and networking, not only with public institutions, but of course with non-governmental organizations, with the whole educational system, international organization, and in establishment of new projects and connections. The plantbiotech.bg webpage will continue to be particularly interesting for the people, as you see here, small statistics done several months ago. The other point of our important work in the STARBIOS project was ethics. Let me tell you that we started to work from point zero on ethical issues in plant science. And for us, it was important to establish a code of ethics and professional conduct in plant science for the AgroBioInstitute, which is an absolutely novelty for such institutes in Bulgaria. We did it using bottom-up approach, so we tried to focus the attention of all colleagues on the topic, giving preliminary discussions and special lectures in this respect. Next. Then the Code of Ethics and Professional Conducts in Plant Science was accepted after a big staff survey on the perception of this important point. And after this, we are focused now on the sustainability of this work. We have implanted already a commission on ethics as a real structural change and a permanent independent unit in the Institute. And something that we think is quite interesting is a special regular course focused on the young colleagues, especially PhD students and postdocs, in respect of ethics in science. So that's for the moment, just to say thank you, and we are open for questions.
Thank you very much, Dimitar. And I will leave the floor to the presentation. Sandra Potusek, correct me my pronunciation, will talk of the action plan at the University of Primorska. And please, I leave you the floor, Sandra. Thank you very much, Sandra, for your presentation. So I leave the floor to our colleagues from the University of Gdansk. Please, Isabella, introduce yourself briefly and then go ahead with your presentation.
Okay. Hello, good afternoon. My name is Izabela Raszczyk. I work at the University of Gdańsk in the International Center for Cancer Vaccine Science as the head of administration. In this presentation, I would like to highlight how multidisciplinary teams have helped us achieving structural changes planned in our STARBIOS2 action plan. The University of Gdańsk is the largest higher education institution in northern Poland with 28,000 students and 3,000 university staff members. Our STARBIOS2 activities have been planned as pilot actions in one of the units in the Intercollegiate Faculty of Biotechnology of the University of Gdańsk and the Medical University of Gdańsk, in short, IFB. The research interests at IFB cover the areas of molecular microbiology, medical biology and molecular diagnostics, as well as molecular plant research. In order to attain structural changes for responsible research and innovation, we planned a wide range of activities. They covered topics in the fields of societal engagement, gender equality, education, open access, and ethics. At a very early stage of the implementation, we realized that in order to attain structural change in the IFB, very often we will need to reach out beyond the Faculty of Biotechnology. We will need to add other expertise to the expertise of the bioscientists, and we will need to act on a university-wide level. In our case, we decided to try to benefit from being in a large university. We have involved experts from other faculties, from different university units, and from various levels of university administration in the planning and in the execution of our actions. It was also of utmost importance for us to include the faculty and university authorities into our core team at a very early stage. Our action plan team became multidisciplinary, and it got like an onion-like multi-layer structure. So, for example, in order to execute activities related to open access, we invited experts from the university library and from the University Office for Science to work with us. Today, we have a university policy on open access accepted by the Senate, and the University of Gdańsk is every year taking part in the International Open Access Week to widely promote open access among researchers and students. Another example is gender equality, where we work together with scientists from the Faculty of Social Sciences. Today, courses including topics such as inclusion, management of diverse teams, responsibility of science are included in the syllabus of all 3 levels of study at the Intercollegiate Faculty of Biotechnology, and they are available to bachelor, master, and PhD students. One further example is societal engagement. Besides the bioscientists, our team included experts from political sciences, technology assessment, management studies, and technology transfer. Biotechnology relates to a range of topics that lack awareness and create enormous bias in society. For example, GMO, in vitro, vaccination, or zoonotic diseases. Biotechnology is a source for solutions for many challenges in these fields, but solutions have to be socially accepted by end users in order to be successfully implemented. We are convinced that responsible technology transfer has a substantial influence on the acceptance and usability of bioscience solutions in society. Therefore, we work closely together with the University Technology Transfer Office that supports the implementation of various research results into practice for the benefit of the end users. And last but not least, I would like to emphasize the importance of multidisciplinary teams at an international level. Such an approach was taken by the STARBIOS2 project itself, as it is executed in a multidisciplinary and international team. And this is a practical approach that we have been taking recently to work in a multidisciplinary team of biologists, biotechnologists, clinicians, entrepreneurs, project managers, research administrators, technology transfer experts, and sociologists to search for solutions for novel T-cell-based therapies for cancer. The awareness of responsibility of science, especially the social acceptance of proposed solutions and the best possible access to results are in the center of the collaboration that you can see described in this slide. Okay, so to sum up, from our experience, we highly recommend to take opportunities of multidisciplinary collaborations in the process of introducing structural change in organizations. At least in our case, it has proven to bring a lot of added value to our efforts. Thank you very much for your attention.
Thank you very much for your presentation. This is the presentation, the slides from the colleagues of Oxford. Are you there, Pavel?
Yes, thank you, Andrea. Hello, everyone. My name is Pavel Ovseiko, and I would like to present on behalf of my colleagues, Rinita, Lorna, Henderson, Sarwar, Shah, Vasiliki, Kiparoglou, and Alistair, the action plan of the University of Oxford, which focuses on the Oxford Biomedical Research Centre. When we started the STARBIOS2 project, a lot of activity had already been going on. Therefore, the project provided us with the opportunity to reflect on RRI, on science with and for society, assess the existing activities, and developed new strands of activity to further catalyze change towards RRI. Our action plan included all 5 RRI keys, and in the next 5 minutes, I will briefly outline our activities with regards to the 5 RRI keys, and then focus in detail on gender and explain why it was so important for us. A large part of our activity focused on societal engagement. As part of it, we reviewed the effectiveness of societal engagement in biomedical research and innovation, and Sarwar Shah is continuing this activity. We also evaluated engaging with technology transfer within the Biomedical Research Center. Gender was the most important part of our work, and in this respect, we developed 4 major areas of action. First of all, we evaluated and assessed metrics and markers of achievement for women's advancement in translational medicine, and Sarwar, Lorna, and Rinita have already submitted 2 papers for publication. Then there is an ongoing qualitative study of women within the Biomedical Research Center. Also, Rinita is finalizing our report based on the gender analysis of authors in scientific publications at the Biomedical Research Center over 5 years. And also, we were scoping and encouraging the use of gender and sex as key variables in research. Next slide, please. Science education, open access, and ethics also were part of our action plan. And in particular, we evaluated opportunities for lectures, seminars, and workshops on RRI. And currently, we integrated a lecture on gendered innovations in one of the master's courses. We were also evaluating open access and developing a framework for comparison which is particularly useful in the context of the Biomedical Research Center. And we had 2 actions related to ethics at the age of concern, and ethics, big data, and research governance. As I mentioned in the beginning, gender was the largest part of our action plan, and now I would like to give the reasons why we focused on gender in particular, because these reasons are universal, and colleagues from other STARBIOS institutions and the wider community might find them particularly useful. Gender is not only about rights and justice. Gender is also about doing better science for the benefit of more people. There is a social progress imperative. Gender is a human right and the fundamental value of our society. So it's a value in itself. There is also a rationale for gender equity from the scientific workforce sustainability point of view, because increasing the numbers of scientists requires retention and advancement of women in science. Our experience that it's not as much about increasing participation of women in education, but it's improving the current system to allow more women who are already in science to develop their careers and to achieve leadership positions. Gender equity also matters for scientific discovery, because there is robust evidence that gender diversity in groups is associated with greater problem solving, higher collective intelligence, and higher quality research. Gender equity is also important for team science because women more frequently than men pursue collaboration, interdisciplinary research, and transformational leadership. Gender equity is important for scientific rigor because women more frequently than men investigate sex and gender-related variables in medical research, which increases its reproducibility and potential to be translated into new treatments for patients or products for the market. And finally, gender equity helps to increase social impact of research, because currently women's potential is underutilized. And so if more women enter the workforce in the fields of science, medicine, and global health, it will improve economic growth. And in the conclusion, I would like to thank everyone for your attention, and I'm happy to take any questions you might have. Thank you.
Thank you very much, Pavel, for your presentation, and we are coming to an end. We can, before leaving the floor to possible questions, I would like to remember you that we have the possibility to see ourselves in our final events. One is very far from Europe, but our project has an international reach. So we have a workshop in Cape Town on 17 and 18 of March this year, and the final event in Brussels, 27 and 28 of April this year. You can have a look at all the follow the information on our website. And finally, I would like to ask you if you have questions we can discuss, and do not forget to have a look to our guidelines that were the basis of the presentation of these 2 webinars, and are a summary of what you have been doing. And of course, we can keep in touch. So thank you very much to everybody for your presentation. If there are no other questions, I would like to take up the occasion to remember again the final events and our update of our websites that will be online soon. And please have a look at the guidelines. Do not hesitate to ask and contact us for whatever reason you may need. And let me thank you again for your participation.
Thank you.
Thank you,
everyone. Bye-bye.
Bye-bye.
Bye-bye. Thank you.
Bye-bye.
Bye.